Hello, everyone, and welcome to Living Healthy and Aging Well. My name is Ken Hageland, and we are broadcasting from the AM 950 radio station that overlooks beautiful Bryant Lake Regional Park, located in Eden Prairie, Minnesota. It is another great day here in the Twin Cities, and I am so grateful to be here with you today, and I hope all of you listening are doing well. We are on the air every Saturday from noon to 1 to talk about your health and your life. We cover a wide range of topics to help you and your loved ones improve and enjoy your quality of life. We have another great show for you today. Joining me in a few minutes will be Harvey Pearl, principal of Pearl & Company, a St. Paul, Minnesota-based insurance agency. Harvey is a licensed agent in life, health insurance for all ages, accident, and travel insurance in the state of Minnesota, as well as other states that you're also licensed in. And he's also certified in several brands of Medicare carriers. And this is really important because Harvey helps protect your quality of life by getting you the right insurance plan for your situation. Today we'll be talking about the importance of participating in an annual review during the Medicare open enrollment period from October 15th through December 7th. So we're right in the middle of that right now here for current Medicare clients. As you may know, Medicare is a complex system of a lot of moving parts and a foreign language to many. So having someone on your side who can advocate for you to make certain that your doctors and your medications are obtained from in-network providers will help keep your expenses as low as possible. So you will enjoy listening to my conversation with Harvey today. He is so full of wisdom to help us make great decisions here. And this is the right time of the year. So if you have a question, folks, be sure and give us a call. I want to thank all of you that leave us messages on our radio show phone line. We appreciate hearing from you, and we welcome your comments, questions, and topics for future shows. Also, if you are interested in being a guest on our radio show, please call or text us at 612-999-3426. You can also contact us on our website at livinghealthyradio.com. There you can find information about upcoming guests as well as listen to our previous shows. And we look forward to hearing from you. We're adding new listeners to the show each week, not only here in the Twin Cities of Minnesota, but also throughout the country. You can find podcasts for all of our radio shows on the AM 950 radio website, and we can also be found on iTunes, Spotify, and many other podcast and streaming services. You can also watch our broadcast live on the radio station's Facebook page at AM 950 Radio. If you have a question for Harvey today, this is a great time to get somebody who just does this for a living and get some answers to your questions. You can do that two ways. First, by calling the AM 950 radio station, and our friendly show engineer, Dan, will get your call on the air. Our phone number is 952-946-6205. Once again, 952-946-6205. Or you can text us throughout the show with your questions at 612-999-3426. Now, don't worry. If you missed those contact numbers, I'll repeat them throughout the show. All right. Well, I'm so excited to have Harvey back here. We're very, very privileged to have him here throughout the fall, as much as his schedule will allow, to be here to answer questions and to make sure that people have the tools they need to make a smart, wise decision. So welcome to the show, Harvey.
Thank you. It's great to be back again.
Yes. And we, again, so thankful to have you here, and we appreciate the wisdom you bring to the audience. And it's like we were talking off the air. It's a moving target all the time.
It's a moving target,
yes. And we've talked before how important our health care decisions that we make are so important, because you're kind of committed for a year.
Right.
And you want to make sure that you're thinking through either as your health situation changes or just life changes need to be factored in.
That's right. And one of the things that we remind people is throwing a dart is risky, because if you just land on something and, it'll be okay for the year, typically people are disappointed with the decision, because once it's challenged, it's not turning out as expected. But you can't muck around with your health insurance. It's got to fit, and it's got to fit your lifestyle. It's got to fit your needs. And comparing with your friends is a good thing in that they care enough about you
Right.
to say, you should be on my plan because it's the best plan ever. It is the best plan for that person. Doesn't mean it's the best plan for you. So what we try to do with our clients is give them a strong spine so that they can say, you have a good health plan too, so do I. And we want you to feel
Right.
good about the type of plan that you have because you want to rest easy at night. You want to go to sleep and just know everything's going to be in place if you need it.
Yeah, yeah. Well, one of the benefits to the competition we have here in the United States with all these health plans and health insurances is that it's great. You can tailor something to meet your needs, but you have a wide array of choices.
Right.
And I know we talked the last time you were on the show that you guys have a sophisticated software program that can help try to narrow those things down, and then you guys put your experience and wisdom on top of that, and it helps to just support people's decision as to
Right.
really what's best for me. And the other thing, we got calls last week or after your last show about should my wife be on a plan? I'm still working. My wife's not working. Should she? And we're over 65. Should she be on? And we'll talk about that later.
Mm-hmm.
But there's a lot of scenarios that you have to think through, and it's it's important to have car insurance and homeowners insurance, but a lot of times they're all kind of the same. This is something so unique and personal.
And changing every
And
year.
every year it's
Yes,
changing.
yes.
And I know we talked a bit about some of the changes that have occurred, and we can maybe talk about that some more of this show. But but I think the emphasis is just don't go it alone. I mean, listen, I think they're always concerned that, if I call up somebody and ask for their help, it's going to cost me money,
Right.
right?
And to that point, what we do is for free.
Right.
And we want our clients to call us all year round with good questions, with whatever questions.
Yeah.
There are no bad questions. There are no stupid questions. All questions are valid. Repeated questions are valid because we want to make sure you really understand stuff. So we remind people, Minnesota Nice does not apply here. So we remind our clients, if you really don't understand what we're explaining, do not nod your head yes when you really mean no, because we need that feedback so we can find even better ways to explain things. Because a lot of this is based on education. Smart people make good decisions, and we want to make sure our clients are empowered with knowledge so that together we're making good decisions. Yeah. And we joke about the pearls of wisdom a little
Right.
bit, but it really is
The tagline.
It's a very
Yes.
important tagline and a play on words because our clients are smart. They graduate the course.
Mm-hmm.
And we come back and we visit throughout the year as life keeps changing and how do we address different needs.
Yeah.
And part of what's happening is what's happening on the front page of the newspaper.
Right.
Because we've had a lot of high stomach acid churning this season because everything is firm for 2025 for Medicare, except for the stuff that keeps changing. So that's clear as mud. So what has been happening is that the health systems, that's where you go to the doctor, and the insurance carriers, that's who's providing the coverage for you. Some of the systems have been saying to the insurance carriers, we're fighting too hard to get paid, and we're not in the business for giving away free health care. So we need an easier process here. And if we can't come up with an easier process, we're just not going to accept your insurance for the new year, which has upset, of course, the insurance carriers, let alone their clients.
All their clients, yeah.
Right.
All the
to
members,
say,
yeah.
wait a minute, my doctor is out of network for next year. Now what do I do? And that's one of the many, many reasons for having an annual review. Yeah. So that if that situation were to be challenged, we will look elsewhere of where your preferred doctors can be in network with another carrier. And that's just one of the many different roles that we play. So why are we free? Because people always ask, well, how do you get paid? Right. We earn a commission when a policy is written, but it's very important that people understand we are not incentivized from one plan or carrier to another. It's all about you. We are your advocate. We are your fiduciary, no different than a financial advisor. We're swinging for your team.
Yeah.
And it's not about what is to our advantage. Our advantage is making sure you're happy and in the right plan. So that's how we're able to provide free service to you.
Right. Well, you don't want to get a call mid-year in 2025 and say, Harvey, my doctor's not in this plan, or
Right.
or I'm really unhappy with what we picked.
Right.
That's a frustrating call.
Yeah, that would be a frustrating call, and I'm trying to recall. I don't recall getting those calls,
Well, because
which
you
is
do
good.
so much work up front. Well, I mean,
Right.
that's why it's a very personalized service that you have, and
Very,
that's why
very.
it's so important, and it's a real benefit to the show to have you on the show because
Well, thank you.
because it's sometimes people just tend to shy away from making decisions. If I don't make a decision, that's a decision.
Right, and the other thing that people find too much comfort in is it worked this year, it'll work next year.
Right.
Not the case. Give us a call at 651-303-8889. You need a review if you've not had one. Please,
Right.
please get a review. We won't charge you anything for it.
It's free.
It's free.
All right. It's time for a short break, folks. We'll be right back to continue our conversation with Harvey Pearl, principal of Pearl & Company, a St. Paul, Minnesota-based insurance agency. If you have a question, please give us a call, 952-946-6205, or you can text us at 612-999-3426. I'm Ken Hageland, and you are listening to Living Healthy and Aging Well. All right, welcome back, everyone. You are listening to Living Healthy and Aging Well, where we talk about helping you and your loved ones improve and enjoy your quality of life. My name is Ken Hageland, and joining me today is Harvey Pearl, principal of Pearl & Company, a St. Paul, Minnesota-based insurance agency. And it's important to get the right coverage, the right insurance coverage for you and your loved ones so you can enjoy your quality of life. It's very important to know that you've got the right product and the right insurance. And this show today is dedicated to making sure that you understand how important it is to get an annual review of your situation. Harvey is a licensed Minnesota agent in life health insurance for all ages, along with accident and travel insurance in the state of Minnesota. As well as other states, but we're going to focus on Minnesota today. And we want to make sure you understand the importance of participating in an annual review during the Medicare open enrollment period from October 15th through December 7th for current Medicare clients. If you have a question for us, please give us a call at 952-946-6205 or text us at 612-999-3426. Harvey, how can our listeners contact you if they have questions or want more information?
Thank you for asking. 651-303-8889. Our phones are only answered by humans. We have no voicemail. So if I can't answer, and Rafael Quintero, my partner in crime on this, he can't answer, and our new assistant Jennifer, if she can't answer, we have a receptionist that will answer. You will always have a human answering our phones. We want people to feel heard.
Well, that's why having a local agent like you is so important. And we talked last segment how it's so important to not go it alone.
Mm-hmm.
There's no reason to go it alone.
There's no reason to go alone.
Because it doesn't cost you anything.
Right.
Phone calls to you, and in fact, there's no charge today if you give us a call.
Right. This
calls
is
to
not
the
call
station.
before midnight.
Right.
No,
Calls to the station are free. Texts to my phone here are free. But it's just so important to have somebody who, this is what you do for a living, and you've seen all kinds of scenarios. You're staying on top of the news. You're behind the curtain in a sense, making sure that you're giving the right advice to your clients. So again, there's no reason not to give you a call.
Right. And, one of the things that we find enjoyable is that the learning goes back and forth. So, yes, we're here to teach. We're here to empower with knowledge, and we love doing that. But situations come up that a client is experiencing that becomes a new situation to us that we've never experienced before. So then that's great, because then we get to sharpen up our familiarity with, when those situations happen, How do we address them? So we appreciate the banter very, very much. And so it's not all about we talk, you listen. It's about we have a conversation and we learn from each other and we work together. This is for years, not for moments. Mm-hmm. So when we start working together, we're in it for the long run because it's about you and your family members and mom and dad. Are their plans okay for the new year? And for those of you whose parents are still in the Medicare system, they need a review. They really need a review. Yeah. Don't shy away from that. December 7th is coming. December 7th is a very hard, firm guillotine deadline. When that guillotine comes down, it's firm. So any changes you want to make, you got to make by December 7th. Please don't call us on December 6th.
Right, but that's true. We should encourage people to call now.
Call now, because our appointment slots are filling up. Yeah. I mean, we're running out of time.
Well, and it's not a cattle call either. You want to make sure you have adequate time to get to know the person, get to know their situation. Mm-hmm. I mean, there's a lot of information that needs to be
there is.
Brought through. I mean, it's your current situation, it's your current health condition, it's who are your doctors that you're seeing, what medications are you on. I mean, it's an important review.
Oh, yeah. It's a very important review. And what's changing in your life? Are you now traveling?
Right.
Whether it be in the U.S. or outside of the U.S., because there are different scenarios. Are you moving to another state? Are you being a snowbird and you're out of town for so many months? Each carrier has different rules of how many months you can be out of town before they question what state do you really live in. So we have to keep on top of these kinds of details.
That's a good point because each insurance carrier is licensed or admitted in certain states.
Right. And the rules change from state to state.
They do, yes.
So we added Maryland to our basket this year, which I'm very excited about. And the rules in Maryland are very, very different than Minnesota. And actually, for those of you from Minnesota, you are so lucky because we are in one of 3 states that get to have different versions of plans that are actually quite advantageous that the other 47 states do not have access to. So don't change your citizenship quickly. If you're thinking of moving to another state, whoa, horsey, give us a call first before you change residency because there are things that you can't take with you if you change residency.
Got it.
Yes.
Got it. Oh, I did not know that.
No, there's something new
no,
every
really.
day.
I've known you for years, Harvey, and you've kept this from me all this time.
Well, every day is a learning experience in this industry.
Which is why it's fascinating. Whatever profession you're in, it's a lifelong practice. It's a lifelong learning.
And you know what? I get up every day excited about what are we going to entangle today? What are we going to address today?
Well, yeah.
And it is exciting. It really is something to look forward to. Yeah. One of the things that's happening, we touched on the issue with the insurance carriers and the health providers not playing in the same sandbox. Well, agreements are being made this week. 2 of them they all made up. And so they're going to play together next year,
which is great. Right in the middle of open enrollment.
Right in the middle of open enrollment. After we've made changes, now we're changing back.
Right.
But that's okay. But because of that, what we're getting an increased number of questions is, I need some certainty. How can I count on a plan to be there for me every year? I want my doctor. This is the doctor I've had for 30, 40 years, and I've trained that doctor. The doctor cannot retire or die. I want that doc.
Yes.
That's good.
Right.
If you always want that doctor, maybe a Medigap plan is for you instead of a Medicare Advantage plan. Mm-hmm. And they are similar, but they're different. So that, too, is very clear.
Right.
But they have different characteristics. You may qualify for a Medigap plan, and that provides certainty. So if Mayo Clinic down the street in Rochester is really important to you, you will always have access to that in a Medigap plan. In a Medicare Advantage plan, that can change from year to year. And even in the paper, there was an article about Mayo Clinic basically saying, if you want to play with us in the new year, make sure your Medicare Advantage plan includes us, because not all of them include Mayo. Right. In a Medigap plan, always accessible, because there are no network limitations. You're only limited to those providers who accept Medicare, which is about 95%-ish of the providers nationwide. So that doesn't limit you to just Mayo, but also MD Anderson and Sloan Kettering and Johns Hopkins, and pick your specialty center. That's giving people a lot of comfort.
Sure
and
would.
if they can qualify for that, if they pass underwriting, if they've been in Medicare for a while, boy, are they relieved.
Wow. No, that is great. Well, what a great segment to give people assurances that
Right.
you've got the answers here, Harvey.
Well, we're trying to get people to sleep well at night.
That's
our
it.
that's our
Quality of
goal.
life. That's what the show is about.
Absolutely.
All right, it's time for a short break. We'll be right back to continue our conversation with Harvey Pearl, principal of Pearl and Company, a St. Paul, Minnesota-based insurance agency. If you have a question for Harvey, this is the time. Give us a call, 952-946-6205, or text us at 612-999-3426. I'm Ken Hageland, and you are listening to Living Healthy and Aging Well. Welcome back, folks. You are listening to Living Healthy and Aging Well, where we talk about helping you and your loved ones improve and enjoy your quality of life. My name is Ken Hageland, and joining me today is Harvey Pearl, principal of Pearl and Company, a St. Paul, Minnesota-based insurance agency. And today we're talking about the importance of participating in an annual review during the Medicare open enrollment period from October 15th through December 7th for current Medicare clients. And as you know, Medicare is a complex system with a lot of moving parts and a lot of decisions to be made, and it can be very confusing to many. So having someone be an advocate for you to make certain that your doctors and medications are obtained from an in-network provider will help keep your expenses and costs as low as possible. All right, before we return to our conversation with Harvey, I want to mention this radio show is brought to you in part each week by Minnesota Hospice. Minnesota Hospice is an independent, locally owned medical practice serving our Twin Cities communities with comprehensive end-of-life health care. The team at Minnesota Hospice provides patients and family members with award-winning end-of-life health care services. You may not be aware that hospice brings compassionate medical, social, emotional, and spiritual services to your home with typically no cost to you or your family. Please do not wait to learn how hospice care can benefit you and your loved ones. If you have any questions regarding end-of-life care or support, please contact the compassionate team of experts at Minnesota Hospice. They are available to answer your questions 24 hours a day, 7 days a week, and they have registered nurses there waiting for your call. Their phone number is 952-898-1022. Once again, 952-898-1022. Or you can simply visit them online at minnesotahospice.com. All right, let's return to our conversation with Harvey Pearl. If you have a question for us, please give us a call, 952-946-6205, or text us at 612-999-3426. Harvey, how can our listeners contact you if they have questions or want more information?
Well, you could send us an email, but I prefer to talk to people. So
I'm the
please
same
give
way.
us a call,
Yep.
651-303-8889. The conversation is always, I find, the best way to communicate, because you really understand, you hear where people's concerns are, you hear where their angst is. And we joke about we relieve stomach acids, but we do. And
Wow.
it's really helpful.
Not only for the clients, but also for the adult children of the clients.
You betcha.
Because, again, healthcare is getting more and more complicated.
Sure it is.
And
Sure it is.
It's important to know that mom and dad have the right plan. Because, again, sometimes it's easy to go on cruise control.
Right.
And that is not what you want to do.
This is not the place to feel comfortable where you're at. It's always going to be the same. It is not going to be the same because the rules change every year. The Inflation Reduction Act is going into effect in January.
Oh, that's right.
So
Big
that
changes
impacts a
the
lot
drug
of changes.
coverage,
Impacts where to get how to afford non-covered medications, which are very highly priced. So we've been trying to find creative ways to bring down those costs and make them digestible. And these are examples about protecting the vulnerable. And
So true.
and understandably, anybody considering Medicare, applying for Medicare, already in Medicare, you are vulnerable, and it's okay to be safe, feeling vulnerable, because that's where we come to play. And one of the ways that you are vulnerable is watching the ads on TV, which are wonderful ads, and they're manipulative.
They spend a lot of money on those
They
ads.
do, but they are manipulative because they're telling you what you want to hear. This is free. You have a $0 premium. You get dental. You
We'll
get
send you
vision.
meals.
Right. We'll send you to Bermuda. Just sign up. Call one of our captive agents at 1-800-PLEASEIGNOREME.com, and they'll sell you a plan because all they want to do is sell you a plan. They don't know who you are. They don't care who you are. When you call back, you're not going to get the same person. You're going to get the next person, and you will be a number. And in my agency, we don't deal with numbers. We deal with people. And we want you to know that when you call us with your questions, we've got the notes to refer back to and say, okay, this is a good question, and you want to make this change, but what about this condition that you have? And people appreciate being remembered of whatever their health history is, whatever their circumstances are. And that's where you apply. So in the software you referred to before, software is great. The algorithms are wonderful. But then we look at it and see if it really makes sense.
That's true.
So it's a matter of taking it the next step. It's not just a matter of accepting what it tells us.
Well, and that's why you mentioned earlier, it's good to stay in touch with you throughout the year.
Exactly.
Don't just wait for these 6-7 weeks here.
We frequently say, as life happens, give us a call.
Right, because then you can update information and make sure that, again, everything is going according to plan, and then you can anticipate making then changes potentially in the next open enrollment.
Right, exactly. So one of the things we learned recently, and actually I learned it from myself having a procedure recently, and there were 7 people in the room. I was lucky, I got the table. So I was able to squeeze in there. And Medicare is coming around the corner for me in about a year or so. But this was not a Medicare billing, but it occurred to me that the doctor who provided the procedure, I knew he was Medicare. He accepted Medicare. I didn't know about the anesthesiologist. How about the tech? About the other people in the room? Do they each accept Medicare? And so when you're anticipating a procedure, it is critical that you ask, does the doctor accept Medicare? Does the anesthesiologist accept Medicare? And whoever else is going to be in the room, I want to know, do each of them accept Medicare? And do not let that desk clerk blow you off and say, yeah, we all take Medicare. That's great. Bully for them. Does this doctor take Medicare? Does this anesthesiologist take Medicare? And write the person's name down who you're speaking with and the date that you speak with them. Because what you don't want is after the fact to get a bill from that anesthesiologist because, in fact, didn't accept Medicare. But if you've got some proof of who you spoke with and got advice from, this will help protect you. And these are some of the pointers that we educate you on how to protect yourself, how to self-advocate.
So essentially, before you go into a procedure, especially if it's an elective or you have time to be able to do that research, is to find out who will be attending, who will be involved, and then just to get a confirmation that they do accept Medicare, because, as you said, 5% of the healthcare community does not.
They choose not to, and there's good reason why not to.
Right, for sure.
But most do, but we can't find comfort in that.
Right.
We have to know that specifically, this physician, this assistant, this tech, this whatever, they each accept Medicare.
Now, so if you knew who they were, can you go online and find out if that person accepts? Is there a database online, or do you have to
There really isn't
call their clinic or their
I think it's best to call and speak with someone. And there's a challenge in that because many administrative assistants will say, yes, we accept that carrier. Great. What about this particular plan? This is the plan I'm on.
Oh, that's right.
Are they in network
There's
with
many
this plan?
plans
Right.
per carrier.
So you have to push. And if you're not sure what those questions are, ask us. 651-303-8889. Because we'll empower you with the questions
Right.
so that you know what to ask
Sure.
for, because this is an ongoing conversation. And, what we want to prevent is from people shooting themselves in the foot.
Yes.
And we were talking during the break, those that are on Medigap plans will see these ads or be, approached, enticed with, I get free this, I get free that. Trust me, the free isn't free. You're going to pay for it somewhere else. And they'll get enticed to drop their Medigap plan because I can get a zero premium plan somewhere else. That's great. But you may not be able to get that Medigap plan back because you would have to go through underwriting and have to go through approval. You can be denied. So you don't want to just drop that Medigap plan freely. If there's a cost factor involved, let's talk about that. Let's find more affordable ways to address that, because it's got to work in your budget. It's got to work within your cash flow. No, we are not interested in just having you buy stuff. It's got to be the right stuff that fits you. Everything is very, very customized here. Yeah. And so that's what we're really, really just totally passionate about. And we're very protective of our clients.
And I'll remind people, no fee ever.
Right.
So again,
right.
Just call.
Just call. It's
Tap
okay.
into this years of wisdom that you and your team have accumulated. I mean, really, it just doesn't make any sense why people wouldn't just reach out.
Right. And frequently our clients say, how does anybody do this without some type of guide?
Right.
And and we certainly appreciate those comments.
Yeah.
But our clients do walk away appreciative of how much more comfortable they are knowing what to anticipate.
Right.
So and we get the fun surprises every once in a while. So we have clients who were in a Medicare Advantage, were in a Medigap plan, somehow or other got talked out of it, and got an Advantage plan and wanted their Medigap plan back and said, can I get there? And so we said, well, let's go through underwriting and see what happens.
Right.
If you can pass at the age of 88, go for it.
Yeah.
And we just passed another one last week who is 82, in incredibly great health, thank goodness, and he's going into a Medigap plan, and he's thrilled. So we have dubbed these people the Pearl and Company Walk on Water Club, and we're really proud of them because we're all living longer. Yeah. And we're all, even if we're not the most healthiest, we're living longer, we're living more active lives. Getting into your 90s is no longer an odd situation.
Oh my gosh, we have patients in their hundreds.
Right, exactly. And so we want you to be ready for all of that possible challenge of what might happen later on in years. This is the gamble that insurance is all about, trying to anticipate what we don't know if it's going to happen or not.
Well, and the insurance companies are experts. And so you as a consumer are considered cheap because you don't have the expertise. You haven't been trained. This isn't your full-time job is to understand insurance,
right?
Especially health insurance, which again is so complicated that it makes no sense to go it alone.
Right, and one of the things that we just underscore repeatedly is we're not just trying to teach you to help make good decisions that we'll make together,
right,
and then do the enrollment and do all the process, but we also teach you how to self-advocate. And that's really, really important because I can't be there for every appointment that you're making. I'm sorry, I wish I could, but but we want to have people prepared and know which questions to ask so that they can get the best outcome.
Right. And it's like you say, a bad decision can haunt you for a long time.
That's right.
In some cases, the rest of your life.
Yeah, that's right. We don't want permanent destruction here.
No. All right. It's time for a short break, folks. We'll be right back to continue our conversation with Harvey Pearl, principal of Pearl and Company, a St. Paul, Minnesota-based insurance agency. If you have a question for us, please give us a call. Harvey would love to answer your questions today. The number is 952-946-6205, or you can text us at 612-999-3426. I'm Ken Hageland, and you are listening to Living Healthy and Aging Well. All right, welcome back, everyone. You are listening to Living Healthy and Aging Well, where we talk about helping you and your loved ones improve and enjoy your quality of life. And I'll tell you, making a bad decision in healthcare really can affect your quality of life, can't it, Harvey?
Oh my gosh, yes.
My name is Ken Hageland, and joining me today is Harvey Pearl, principal of Pearl & Company, a St. Paul, Minnesota-based insurance agency. And today we're talking about the importance of participating in an annual review during the Medicare open enrollment period from October 15th through December 7th. Don't wait till December 6th to contact Harvey. You got to give him a call now, and he has some availability to talk, and would love to hear from you. But if you're a current Medicare client, give Harvey a call. It's so important to have somebody with his expertise helping you make a good, sound decision, especially with all the things that are changing both this year and next year. And so it's just very important.
And for the people who are anticipating Medicare,
Yes.
another year from now, a year and a half from now, whatever, we want to talk with you. We want you to help prepare for Medicare and know what steps to go through. We'll give you a timeline. On this month, this is what you need to do. On this month, this is what you need to do.
That's true, because there are certain windows
That's right.
that are associated with Medicare as well, both for Part A and the traditional, and then Part D.
Right.
So-
And like people need to know that they should be having health insurance over all the years of their life. Even if you feel healthy and you say, I don't need health insurance, I'm healthy, I never see the doctor, that's going to come back to you as a penalty. And so these are some of the things that we point out.
As a financial penalty, right?
You betcha.
Yeah.
And for a lifetime.
For a lifetime.
For a lifetime.
There's no undoing that.
Right.
Yeah.
And so there's a situation going on right now where two of the carriers in Minnesota are ending their relationships with agents and brokers, which we're trying to figure out, okay, what's the agenda here? And we think we figured it out. We think that they are going to poach you as a consumer, as a Medicare recipient. Wouldn't you like, if you have a Medigap plan and you're paying maybe $300 a month in premium, wouldn't you like to save some money? We can give you a $0 premium. Well, that's about the only savings they can give you, because in that Medicare Advantage plan, you're going to have a much higher maximum out of pocket. So, but they're telling you what you want to hear and not necessarily what is. And we have nothing to hide here. We'll tell you all the pluses and minuses. And if, in fact, what they're proposing to you is legitimate, we'll tell you it's legitimate and that you should go with it. So we don't want you to be lured into a false sense of reality. If it sounds too good to be true, it probably is.
Right.
If you don't have an agent or broker, we encourage you to work with your agent or broker. If you don't have one, we'd love to help you out. And I'll give you my number again, 651-303-8889. It's okay to call. We take calls on weekends, people. It's
right.
really okay.
Yeah.
And, one of the things I ask people repeatedly is, when you buy fire insurance on your house, are you buying your fire insurance for when the house is standing and everything is great, or are you buying fire insurance for when the house burns down? Because that's when the decision was, boy, was that a really good decision. I paid, the house never burns down. Why am I paying all this premium? Because if that ever happens, then you're happy to be covered. Health insurance is the same type of thing. You're buying fire insurance on your health. We want you to be as healthy as possible. But if you don't, that's what you're buying health insurance for.
Well, and you said on the break, we're living longer.
Mm-hmm.
I can't think of a person I know who doesn't use healthcare at some point.
At some point or other,
in their life. And again, because of all the things that the availability of technologies are changing, and there's new things, And like I said, as you said, people are living longer, and so the chances of using and needing this maybe more expensive high-tech treatments
Right.
will be even more important that you're thinking through that with someone like you to help, position that in their mind, because you got to be thinking down the road.
Right. So one of the things I'm finding kind of an interesting pattern, AFib is the fashionable thing to have these days because it's coming out of the blue. I'm strikingly healthy, and all of a sudden I have AFib. And that if that happens, okay, we'll deal with it. We'll navigate accordingly. But that's the kind of condition that comes by surprise. Yeah. Different kinds of cancers show up when you least expect it. That's okay. We'll address that. There's nothing to be embarrassed about. There's nothing to be feeling awkward about. As a former nursing home administrator, I've talked about pretty much everything on the face of the earth. I'm not a doctor. Don't pretend to be one. But you're not presenting us anything that we haven't heard. So this is a safe place to talk, and this is a safe place to reveal intimacies.
Right.
We're not spreading anything. It's all confidential conversations.
It's all confidential. You
Right.
guys are held to such a high standard.
We are HIPAA compliant.
Right, with your license and your broker, so that people have a lot of confidence in the fact that they can share that with you guys.
Exactly.
And actually, the industry wants them to share it so you can get the right product and the right connection for your clients.
Right. And you're always in the driver's seat.
Yes.
You have control over what you want to share or not share with us. That's fine. Obviously, the more you share with us, the more effective research we can do. Mm-hmm. But you get to decide that, and we will make sure that you are always driving the bus. We will admit that we will be the backseat driver, but you're driving the bus, and we want to make sure that you always feel in control. Yeah. We're not making the decisions for you. We can't make the decisions for you. We can advise if the decision you're making is questionable, but you end up making the ultimate decision, and then we follow your direction and enroll you accordingly and manage that accordingly and keep up throughout the year. As changes are happening, you'll get notifications from us. So it's not once a year we're talking to you. It's as things are happening, we're sending you updates.
Oh, that's right. Yeah, because you do a great job of that throughout the year. If something changes or something's coming up, you'll email your clients.
Right.
And let them know, hey, let's just FYI, this is what's going on.
Right. And for those few clients who do not have email, we do have a few of those.
Oh, sure.
That we call them, or if they want to be texted, we text them. So we'll do whatever we can do to make sure the communication is always going. And our client, I ask often, are we drowning you in emails? Are we sending too many? And no one has ever said to us we're sending too many. They always say our emails or our communications are pertinent, they're relevant, they're appropriate, and when they don't make sense, people give us a call, and that's exactly what we want them to do. Right. So so long as the communication is running back and forth, then it works. Communication works when everything works when communication works.
That's the foundation of things working.
Exactly.
All right, Harvey, this has been great. Thank you so much for being here. I want to thank Harvey Pearl, principal of Pearl & Company, a St. Paul, Minnesota-based insurance agency, for joining us today to talk about the importance of having an annual review during the open enrollment period, which is going on right now.
And December 16th, we're coming back for one more touch base.
That's right. And the number to call you is?
November 16th, rather. 651-303-8889.
All right. Join us again next Saturday at noon for another live broadcast, and thank you for listening to Living Healthy and Aging Well, where we talk about your health and your life. Until next time, choose to live well.
Singing Italian song.